Studies have shown that approximately 70% of the information coming into our brain in any one moment is visual. And scientific studies have also shown that we retain neuroplasticity, meaning the brain is flexible at any age. So through specific visual training procedures, we can work through neuroplasticity to change the brain. Yeah, it's a learning process to retrain the visual system to be more efficient. So the individual can take in more information in a better quality and more rapidly. Yeah, absolutely. The more secure we are in visual space, the more possibility for internal security. The father of behavioral optometry, his name was Dr. Skeffington, has a very famous quote: "A person who is insecure in their vision is insecure in their ego." There's a complex interplay between vision and environment, so it's not just vision makes a certain personality. Your parents are involved with this, certainly. You know, your friends, your brothers and sisters are part. But even with a wonderful family, okay, if you're insecure again with your vision, it makes you more insecure as a person. Okay, so it doesn't mean if you have poor vision you have to be insecure, or that everyone who is insecure has a vision problem. People who are nearsighted tend to be more central, more focused. They talk a lot in their heads. They generally like to read more. They're more internal people. People who are farsighted generally, in general, more outgoing, more peripheral, more difficult to focus. Yes, I was in special classes all of my life. Okay, I did very poorly. I had a very poor self-image. I thought I was not very smart, and that was all the way through till I was 23 years old. And then I had visual training, and then I was able to read easily and remember what I read, understand better. Everything in my life got better. More secure when I was driving. Everything changed. My program was almost 1 year. I never read a book until I was 23 years old. I mean, I was forced to read books in school. I never read a book for pleasure until after I was 23. Yeah, well, first, it's also a surprise to me because when I was growing up, I never had big dreams because I was at the bottom of the class. I never did well. I wasn't so good in sports. It was a difficult time because my ego was I was insecure. And again, reading was difficult. After the visual training, reading got easy. I started reading, and understanding and making concepts in my head. And then sometime later, someone asked me if you could develop an instrument, what would you like to develop? So in about 1 year, 18 months, we developed this. Absolutely. What would be beneficial, exactly. I tried to put the types of things that were beneficial for me into the program. Well, personally, the oldest person I ever worked with was 72 years old, with wonderful results. I have a very close friend and colleague who practices in Israel. He had a patient 91 years of age. So no, there's no upper age. Neuroscience has shown that neuroplasticity is throughout life. So basically, this can help from birth.
Así que básicamente el rango va a ir desde que naces hasta que te mueres.
Well, there's a tremendous interest now. I think about myself as the spark, the cheese spark, but now the fire is burning. Okay, so Brazil is on fire, Spain is on fire, Canada's and the United States for a long time. Okay, so the interest grows every year. As optometrists understand the benefit they can have for their patients, not just to make people see more clearly, but actually to change the lives of their patients in a profound way, is very exciting. It's very good for the heart. So the patient benefits, but the behavioral optometrist also benefits, because there's no bigger satisfaction to change the life of a child or an adult like my life was changed. The biggest challenge, I think, is what has been accepted in truth in the past. The more things have been told, the more people think it's true. And people are not reading the new neuroscience, which shows that many of the concepts we had in the past are not true. So one example, people still say today that you can't help a child with lazy eye after age 8. It's clear from neuroscience over the last 10 years that that is absolutely not true. Okay, so but still some of the people do things the same way. There's a very famous quote also: it takes more than facts to change men's minds. It takes time. Well, a little bit, it's changing now. The medical community, more and more, the people here are getting referrals from psychologists. So it's changing now, but there are still the people who resist change. It's not just true in optometry, it's true in everything in life. Studies have shown that improving visual acuity is only a small part, that they need to look at other visual abilities. They need to evaluate visual reaction time, visual fields, visual attention, contrast sensitivity. If they measure those things, they can then, if they find problems, they can do visual training procedures to improve those abilities and then make driving more safely, especially in older people. That I was able to show them a way to change the lives of their patients, that I was a good guide.